Hello, everyone. My name is Mary Catherine Galloway, and today I will be presenting my PowerPoint presentation concerning nurse burnout that coincides with my scholarly paper. I'm an RN to BSN student of the College of Nursing and Health Professions at the University of Southern Mississippi. I'm currently enrolled in the nursing leadership class under the direction of Dr. Kimberly Smith. So, before we dive into the PowerPoint, I kind of want to give you a little bit of a preface of what we're going to be discussing, such as the question of what is nurse burnout, what all it entails, the contributing factors, the consequences of nurse burnout, why it's important for managers to be aware, how it can help healthcare workers be aware of their own signs of burnout, as well as helping their coworkers be aware and accountable for their burnout, as well as evidence-based treatments and solutions for combating burnout as a whole. So first, a question: what is burnout? So often, nurse burnout is misunderstood to simply just be exhaustion from a long day or you just need a vacation, when in reality, nurse burnout is a systemic issue that affects safety, workplace morale, and the future of healthcare. You see, nursing is a very demanding profession that requires a great deal of compassion, resilience, and critical thinking. Burnout occurs when repeated stress exceeds a nurse's emotional, mental, spiritual, and physical capacities. Burnout threatens patient safety. It heavily affects workplace morale and can negatively affect and compromise the ethical standards in healthcare. There is a rising prevalence of nurse burnout that has significant consequences for the nurses, patients, and organizations alike. To kind of dive in a little bit further of like what is nurse burnout, I'm a firm believer that if you want to treat something, you must first understand it. Um, Nurse burnout is a large state of emotional, mental, spiritual, and physical exhaustion from chronic workplace stress. Um, no career nor profession is exempt from stress or having bad days or anything of that nature, but nurses are put under more pressure because there is so much responsibility that lies in their hands. They must be quick, agile, flexible. They have to know how to treat all of their patients differently with all their different diagnoses and problems at hand. They may be severely understaffed, um, and expected to have good attitudes and, you know, be a very supporting person for their patients in the hospital. And that can cause a lot of burden and create a lot of stress for a nurse over a period of time if these things are done in an unhealthy manner. Um, Oftentimes, the early signs of burnout are kind of pushed under the rug and ignored, and it can lead to advanced burnout. Some of the early signs include disengagement, detachment, irritability, and loss of empathy. Some of the signs of the advanced burnout include cynicism, hopelessness, depression, and reduced workplace professional fulfillment. Um, Nurse burnout is often viewed as a personal flaw when that is simply not the case. It is a response to an unsustainable work condition that deteriorates the nurse over time. Some of the contributing factors that can lead to nurse burnout, according to the American Nurses Association, include chronic understaffing and unsafe nurse to patient ratios, mandatory overtime and unrealistic workload expectations, poor leadership support and high turnover within units, emotional strain from caring for critically ill or dying patients, and moral distress and lack of organizational resources for support. Understanding these causes are crucial to helping your facility overcome the nurse burnout crisis that is sweeping the nation. What are some of the consequences of burnout? Um, Unfortunately, consequences of burnout not only affects the nurses experiencing this, but it can negatively impact organizations and severely impact patients as well. Some of the consequences for the nurses includes emotional exhaustion, irritability, detachment, increases anxiety, depression, and mental fatigue, as well as being as severe that it causes physical symptoms to arise as well, such as chronic tiredness, insomnia, headaches, and GI issues. And for organizations, some consequences that you may see here includes increased turnover rates and difficulty retaining staff, decline in team morale and collaboration, financial strain due to onboarding and training new nursing staff as it affects productivity costs. Because if you think about it, whenever you hire a new nurse, you have the new nurse who needs to be paired with an already experienced nurse for this job. So you have two nurses who are being paid two nurse salaries to complete one nurse's workload for a period um, anywhere from between 6 to 12 weeks, and that can negatively, or that can cause, like, a big impact into a hospital's budget. And most importantly, the consequences of burnout can negatively impact the patients, as there is a higher risk for medication errors and clinical safety. It can reduce compassion and impaired communication, and there are lower patient satisfaction and trust rates when patient or from patients who have taken surveyed after being under the care of a burned out nurse. Um, this is very important because one negative interaction from a burned out nurse and a patient can make the patient very fearful of going back to the doctor or going to the hospital, and it may cause them to forego very necessary treatments for their health. So, how can healthcare managers use this information? This information is very vital to patient care managers because it can help them in recognizing the early warning signs of burnout in staff. It can help them implement and enforce safe staffing policies and fair workloads amongst their staff, fostering a supportive and communicative leadership culture, providing regular check ins where staff feel heard and valued, ensuring access to counseling, peer support, and wellness programs, as well as leading by example by modeling mental health prioritization and positive leadership behaviors. How can healthcare workers use this information? It is very important that healthcare workers are able to understand burnout so that they may recognize these signs and symptoms for themselves, as well as keeping their coworkers accountable and being a supportive figure for them as well. Um, it can help them utilize self-care strategies such as breaks, hydration, mindfulness, taking their well-earned PTO, and even seeking counseling services. It can help strengthen emotional resilience and maintain work-life balance. It improves patient care by reducing stress and increasing focus, building strong team relations and peer support networks, as well as creating a healthier, more collaborative workplace environment. Here's kind of a summary of some non-research articles that I use to help support my ideas with my scholarly paper. One of them being from the American Nurses Association, and it emphasizes ethical responsibility to promote nurse well-being. It links nurse fatigue to patient safety, staffing issues, and lack of support, and it recommends breaks, appropriate staffing, and mental health resources. And then the National Academy of Medicine defines burnout as a systemic issue and not an individual failure. It advocates for workflow design, leadership accountability, and psychological safety. It calls for reduction of administrative burden and improved organizational culture. Here's kind of a summary of some evidence-based interventions that I found to help nurses who may be dealing with nurse burnout kind of return to a place of center. such as utilizing techniques such as mindfulness-based stress reduction or MBSR, as those can reduce emotional exhaustion and improve coping skills. A great example of this is box breathing. That is where an individual, typically for 5 seconds or so, inhaling for 5 seconds, holding that breath for 5 seconds, exhaling over 5 seconds, holding over 5 seconds, and then repeat. Supportive leadership models, such as balanced assignments, open communication, um, can lead to lower burnout. Peer support and resilience programs, such as structured debriefs to reduce emotional workload, and support groups that can improve coping and team connectedness. Some facilities even offer some counseling services in some form or fashion. I'm very thankful to work at a healthcare facility that provides all of their staff members with at least 10 free counseling services should the employee need it. And then finally, system level interventions such as adequate staffing, safe ratios, policy improvements, break enforcement, and workload redesign. And to conclude this presentation, I want to give kind of a final summary for you guys, such as burnout is a widespread, preventable issue affecting nurses, patients, and organizations alike. The root causes are systemic, such as understaffing, unrealistic workloads, and poor leadership. Evidence shows that mindfulness-based stress reductions, supportive leadership, and peer programs can really reduce burnout. Organizational change is essential for sustainable improvement, and supporting nurses improve patient outcomes, retention, and overall healthcare quality. And these are the references that I used. So this concludes my PowerPoint presentation on nurse burnout. Thank you so much for listening.